Good day. My name is Dr. Tatiana Nikolaevna Prokopyeva, and today we will discuss about pathology anatomy.
Информационные технологии обеспечивают.
Начинаем очередную лекцию.
Topic of this day is acute inflammation. Pay attention, it's not full information for this topic, it's only essential of knowledge for this term. Let's go. Inflammation. Inflammation is a complex thermovascular response to ensure, leads to eliminate the insurance agents to the repair of damaged tissue. Inflammation Inflammation is a protective, adaptive reaction directed to the elimination of area of damage, destruction of organs that cause inflammation, restoration of damaged tissue, repair. Restoration of damaged tissue, nomenclatures of terminology of inflammation. Name of inflammation in organs and tissue formed by adding suffix it-ic to the name of the organs or tissue in Greek or Latin. For example, hepatitis, inflammation in the liver. Gastritis, inflammation in the gastric mucosa. Etiology. Etiology of inflammation can be caused by a variety of factors. Biological factors, exogenous and endogenous, such as bacteria or other invert organisms on the cells metabolic products, immune factors, antibodies, immune complex, and synthesis lymphotic sets. Physical factors. Physical factors such as radiation, electrical current, high and low temperature, ensure mechanical similar. Chemical factors. Chemical factors such as drug, toxin, poison, etc. Etiology or biological factors. Next classification of inflammation due to the etiology. Specific inflammation, non-specific inflammation. Specific inflammation, it is caused by certain factors and has which characterized morphological features. This inflammation can be caused Mycobacter tuberculosis, inflammation in leprosy, syphilis, and actinomycosis. If about non-specific inflammation, it is caused by other biological factors like Escherichia coli, physical and chemical factors. Inflammation classification according to the duration. Acute inflammation. Acute inflammation, it is a form of the inflammatory response that develops intermediate after exposure to damaging agent. It is characterized by a predominance of exudative tissue reaction and repeat completion of the process with elimination of the damaging agents and repair of tissue. Duration 7 to 10 days. Chronic inflammation. Chronic inflammation, it is a long process, more than 6 months, with tissue damage, reactive change, and process of healing, scarring, acute simulation, and periods of expansion are replaced by remission. If we say about subacute inflammation, it's between acute and chronic inflammation. Classification of inflammation may be according to the type of tissue reaction. One of them, hypoergic. Hypoergic inflammation is in a pretty weak reaction to the harmful effects of the damaging agent. This inflammatory response may be due to the depletion of the protection force of the organism caused by previous chronic disease, physical overwork, starvation, a weak type, a high nervous activity. Hypoergic. Hypoergic inflammation occurs in case a violent of adaptive and trophic function of the nervous system, allergic condition of the inflammation. It is characterized by a very severe and not acute harmful damage. Necrotic process dominate over regenerative. Normoergic. Normoergic inflammation is an adequate response of the organism to the damaging effect. The outcome of this inflammatory response is healing as it occurs under the influence of neutralization, superpression, extraction, absorption of insulation of foreign objects of the tissue on the body. Next, inflammation, morphological types. Classification of inflammation according to the morphological types of inflammation. One of them, ulcerative inflammation. Ulcerative inflammation, it is characterized by the prevalence of degeneration and necrotic lesion. It is not ulcerative separate type of inflammation. Exudative. Exudative inflammation, it is inflammation with predominance of exudating process, mainly acute inflammation. And next is productive proliferative inflammation. It is inflammation with predominance of proliferation phase, mainly chronic inflammation. Next, signs of inflammation. 5 signs of inflammation. Color, rubor, tumor, dolor, functionalism. Rise of temperature is color, redness on inflammatory rubber, swelling on the inflammatory focus tumor, pain due to the damage of the nerve tumor, loss of function, functionalism. All these clinical and morphological manifestations are associated with dynamic reaction during the exudation phase. Redness and fever are due to increased blood flow of the inflamed region. A variety of biological activity subtends that enter the nerve ending, and loss of function is caused by a combination of factors. Inflammation, morphogenesis. Inflammation includes 3 successive phases of development. One of them, alteration, exudation, and proliferation. Alteration is the damage of the tissue, is defined as the initial phase of inflammation, manifested by various types of dystrophies and parenchyma and stroma of organs up to the necrotic change. This initial phase of inflammation leads to the release of mediators that determine subsequent development of inflammatory response. Inflammatory mediators that process result in morphological manifestation of inflammation. Primary inflammation. Alteration. Primary alteration, it is occurs in response to a direct effect of inflammatory factors and prolongs its pathogenic effects. The extent of nature of the alteration depends on the intensity and quality of the pathogenic factors and location and the damage area, as well as presence of the damaging structure and the whole body. Secondary alteration, it is occurs under the influence of various pathogenic factors, both as the local, physical, and chemical factors, amount and activity of inflammation mediators, vascular reactions, and systematic. Nervous and humoral includes endocrine and immune reaction change. Exudation. Exudation, it is a reaction of the microvascular with change of the rheological properties of blood, symptoms of increased vascular permeability, plasma exudation, and immigration of cells, phagocytosis, and formation of exudate. The following processes are the basis of exudation. Reaction of the vascular with impaired blood rheology, increased vascular permeability at the microvascular bed, exudation of blood plasma components, immigration of blood cells, phagocytosis, formation of exudate inflammation cells, inflammation. A cluster of cells in tissue encode inflammatory cellular infiltrate. The composition of exudate cells different. During the first 24 hours, exudate consists of fervent polymorph neutrophils. Between 24-48 hours, there are predominantly monocytes and macrophages. When the inflammation is associated with the reaction of intermittent hypersensitivity, exudate consists predominantly of eosinophils. Proliferation. Proliferation, it is the final phase of the inflammatory providing repetitive tissue regeneration and the site of alteration. The proliferation process is characterized by proliferation inflammatory cells such as macrophages, cambial mesenchymal cells, smooth muscle cells, and epithelium. This way we understand morphogenesis of inflammation. Inflammation includes 3 successive phases of development: alteration, exudation, and proliferation. So, next slides again about morphological types of inflammation: alterative inflammation, exudative inflammation, productive inflammation. Alterative inflammation Until recently, among the morphological types of inflammation, ulcerative inflammation was present, which are characterized by the prevalence of alteration, necrotic inflammation, while exudation and proliferation phase are present very poorly or not all or different. Currently, the extent of this type of inflammation is denied by most pathological of the grounds, the so-called ulcerative inflammation. Vascular mesenchymal reaction, which conceals the essence of the inflammatory response. Thus, in this case, it rather necroses the inflammation. Exudative inflammation, it is characterized by the predominance of exudation and the formation of cavities in the tissue with the presence of exudate. The nature of fluid depends on the state of the vascular permeability and depth of the damage that determined by the type and intensity of the damaging factor. Depending on the nature of fluid, there are several types of exudative. One of them serous, next fibrinous inflammation, purulent, putrefactive inflammation, next one hemorrhage inflammation, mixed inflammation, and catarrhal inflammation. That way we know 7 types of exudative inflammation. Serous inflammation, fibrinous, purulent, putrefactive, hemorrhage, mixed, catarrhal. Serous inflammation. Serous inflammation is characterized by the formation of fluid content of protein and small number of cells. Progression of the serous inflammation is usually acute. Etiology. Etiology, thermal and chemical factors, viruses, herpes labials, herpes zoster, bacteria, rickettsia, allergens of plants and animal origin, autotoxin, and etc. It is most often located in serous membranes. Mucous, skin, or these internal organs in the liver, exudation in the perisinous space, in the heart, between the mucous fibers, in the kidney, in the lumen of the glomerular capsule, in the stroma. Morphologically, serous exudate is essentially has the opalescent yellowish fluid. It contains mainly albumins, globulins, lymphocytes, few neutrophils, epithelial or mesenchymal cells, and resemble transudate. Outcomes is favorable. Even significant amount of fluid can be dissolved. It's the internal organs on the outcomes of the serous inflammation can be chronic course resulting in the sclerosis. Fibrinosis. Fibrinous inflammation. Exudate contains large amount of fibrin which are formed from fibrinogen by the action of tissue thromboplastin. Etiology. Etiology fibrinous inflammation. It may be caused by diphtheria and dysentery, Frankel diplococcus, Mycobacter tuberculosis, influenza virus, endotoxin, mercury chloride poison. Localization. Localization of fibrinous inflammation usually develops on the mucous and serous membranes. Form of films or settlers that depends on the organs in the lung. Depending on the nature of the fibrinous found and underlying tissue, there are 2 types of fibrinous inflammation: Kruppe's inflammation, diphtheric inflammation. Between these 2 types, there is a fundamental difference. Kruppe's inflammation is a developed primary and serous and mucous membranes covered with clinical epithelium, loosely relation of the underlying tissue. There is a shallow superficial necrosis and fibrin deposits of the necrosed mass. Fibrinous inflammation, this film contains fibrin with calm polymorphonucleus leukocyte, can be easily dilated. Examples of such inflammation are fibrinous pericarditis. It may be occurs in uremia, rheumatic fever, transmural myocardial infarction, Krupp's pneumonia. The pericardium of due to concession edema, a proliferation of cells. On the surface, there are fibrinous deposits which are sometimes exposed to the organization. Outcomes of fibrinoid pericarditis. There could be adhesion between the layers of the pericardium, adhesive pericarditis, often with the obliteration of the pericardial cavity. Sometimes sclerotic membranes become calcified, it accrues stone hard. Next, diphtheric. Diphtheric inflammation. It develops in the mucous membranes covered with sterling squamous epithelium, which are closely under the underlying tissue are covered with column epithelium in the presence of deep necrosis. In this case, there is a deep necrosis and deposition of fibrinous mucosa and submucous layer. Examples. For example, such inflammation are diphtheria colitis. Diphtheria colitis develop in bacterial dysentery. Ulcerative defect or RSF film reaction can be visible. Mucosa is partially necrotized. There is distrute and fibrinosis exudate in the form of film-coated submucosa. The vessels are dilated and congestive. There is self-inflammatory infiltrate in the porous tissue. Outcomes of diphtheric inflammation: scarring, organization, or exudate, bleeding, and perforation of the intestinal wall due to the formation of ulcer. Purulent inflammation. Purulent inflammation, it is characterized by predominance of polymorphonucleoleucocytes intact and residing in the exudate. Etiology. Etiology: pyogenic bacteria, Staphylococcus, Streptococcus, Gonococcus, Meningococcus, Pseudomonas aerogenesis. Morphology. Morphology is the main feature of histology, with destroyed in the tissue with proteolytic enzymes of leukocytes such as neutral proteases, collagenase, allostasis, catepsis, and acid hydrolysis. Purulent inflammation. There are two main types of purulent inflammation: limited and diffuse. Limited purulent inflammation: abscess, furuncle, and carbuncle. Abscess, it is a focal purulent inflammation with the formation of a cavity filled with purulent exudate with yellow-green color. Furuncle, it is necrotic inflammation of the hyophilus sebaceous glands of surrounding connective tissue caused by pyogenic bacteria, especially its Staphylococcus aureus. Carbuncle, it is necrotic inflammation of the skin and subcutaneous tissue around the group of hyophilus and sebaceous glands, and is hesitant and spread rapidly. Diffuse. Diffuse purulent inflammation: phlegmon, cellulitis, and empyema. Phlegmon, it is diffuse purulent inflammation. Most often it occurs in subcutaneous tissue in the fascia along the neurovascular bundles, also may occur parenchymal organs and meningitis of the brain, spinal cord. Phlegmon is acute inflammation. There are hard and soft phlegmon. Hard phlegmon, diffuse coagulation necrosis that develops on the background of macroinflammation followed by granular tissue reaction. Soft phlegmon, it is a condition with the predominance of lysis of the necrotic tissue. There are numerous neutrophils, granulocytes around the fibers of striating muscles and adipose cells. The designated neutrophils form a purulent exudate. Cellulitis is the acute diffuse purulent inflammation of subcutaneous fat. Empyema. Empyema is a purulent inflammation which accumulation of pus and includes a poorly drained expression cavity. Examples include of the accumulation of pus in the pleural, pericardial, peritoneal cavities, paranasal sinuses of the gallbladder, appendix, fallopian tube, called physiophallopiditis. Hemorrhagic inflammation. Hemorrhagic inflammation is characterized by the formation of the exudate, mainly represented by RBC. The mesenchyme is based on the scientific increase in microvascular permeability followed by diapedes of RBC. Emigration of leukocytes is slow due to the negative chemotaxis. Etiology. Etiology: hemorrhagic inflammation. Several infections such as influenza, plague, anthrax. Hemorrhagic inflammation sometimes can be observed together with other types of the inflammation, especially in lack of vitamin C, and the patients suffer from disorders of the hematopoiesis. Localization. Localization: hemorrhagic inflammation occurs in the skin, mucosa on the upper respiratory tract, gastrointestinal glands, and lymph nodes. An example, it is hemorrhage pneumonia in influenza. Outcomes. Outcomes depend on its cause. Favorable outcome is possible with complete resorption of exudate. Putrefactive inflammation. Putrefactive inflammation have etiology caused by a group of Clostridial anaerobic infection pathogens such as Clostridium perfringens, Clostridium septicum. Inflammation is usually developed due to the several species of Clostridia and combination with aerobic bacteria. Localization. Localization it is more common of wounds with extensive crash ensure. Outcome the unfavorable and is more common due to the massive destruction and reduction of the organism. In the background of antibiotics and combination with surgery is impossible. Catarrhal inflammation. Catarrhal inflammation etiology. Etiology of catarrhal inflammation: bacterial and viral infection, allergic reaction, effect of chemical and thermal factors, endogenous toxin. Localization. It develops in the mucous membranes and is characterized by the presence of exudate leaking from the mucous surface. A distinctive feature of the catarrhal inflammation is an admixture of mucus to any exudate. Outcomes. Outcomes as usual is favorable. Chronic catarrhal inflammation may lead to atrophy or hypertrophy of the mucosa. Mixed inflammation. Mixed inflammation is observed in case when one kind of exudate joins the other, the result in serous purulent, serous inflammous purulent, hemorrhagic, and other types of inflammation. Etiology. Etiology of mixed inflammation: combination of exudate is associated with the morphogenesis of inflammation, secondary infection, or reactive change. Morphology is a dependency by combination of morphological features specific for different types of exudative inflammation. Outcomes. Most of case outcomes are unfavorable. It's all for today. Today we will discuss about acute inflammation. The next lesson I wait you with some chronic inflammation. Have a good day. Goodbye.